Hello, everyone. Welcome. Thank you for joining us today. As you enter the room, please feel free to fill out the poll questions, which you'll find on the screen. We'll begin promptly at 3 o'clock, so we'll allow a few more minutes for others to join us. But as you can see, which of the following best describes your organization, and then on average, how many people die from drowning in the U.S. each day, and when did you learn how to swim? Those are our poll questions. So thanks for participating. It's fun to see everyone active there. Interesting to see that so far 88% of you learned how to swim as a child, and 65% of you are guessing or maybe knowing that 11 people each day die from drowning in the U.S. So that's the most popular answer so far. For those of you just joining us, welcome. Thank you for joining our webinar today. We will start right at 3 o'clock. So as you wait, you can answer the questions that are on the screen, our poll questions, asking how you would best describe your organization, how many people die from drowning in the U.S. each day on average, and when did you learn how to swim? Thanks everyone for joining us. We will start in just less than a minute. We're glad you were able to join us today. As you're waiting for the webinar to start, you can answer our poll questions about how many people die from drowning in the U.S. each day on average, and when did you learn how to swim? So far, 80% of those of you in the room learned how to swim as a child, and 13% in your teen years. 8% are saying they do not yet know how to swim. Hello, everyone. Thank you for joining us. We're really glad to have you here this afternoon to talk about this really important topic of why do racial and ethnic disparities in drowning risk exist, and how can they be addressed? So thank you for joining us this afternoon, and thanks for participating in the poll questions that we had as you were in the waiting room. As many of you, the majority of you accurately guessed, 11 people die each day from drowning in the United States. That was information I did not know until this. So I'm eager to hear more about how we can, what we can do to address this public health issue. So again, the name of the webinar is Why Do Racial and Ethnic Disparities in Drowning Risk Exist, and How Can They Be Addressed? And this is a webinar of the Children's Safety Network, which is part of the Education Development Center. This is me. My name is Lynn Brettel. I'm the director of the State Adolescent Health Resource Center at the University of Minnesota, located in Minneapolis. And I'm a member of the Children's Safety Now Alliance, which is how I have the honor of being the moderator of today's webinar. Our project is sponsored and supported by Health Resources and Services Administration of the U.S. Department of Health and Human Services under the Child and Adolescent Injury Violence Prevention Resource Center Cooperative Agreement. So you can see how this webinar is supported through this funding through HRSA and this cooperative agreement through HHS. Before I introduce our speakers, there's just a few technical things we want to cover. So I'm going to hand it over to Kate Sinclair so she can cover those items.
Thanks, Lynn. So if you can hear me right now, you'll know that audio is being broadcast through computer speakers. If you're having trouble hearing me at all or you have any audio issues during the webinar, you can dial in at 866-835-7973 and remember to mute your computer speakers. You will be muted for the duration of this webinar, and any questions you can have, please use the question and answer box at the bottom left to ask questions at any time. We'll be getting to those at the end of the webinar. Up at the top of the screen, you'll see our download pod, which has today's files, and then you'll see our web link pod, which has links to lots of different great resources that will be mentioned during the webinar. This session is being recorded and will be posted on CSN's website within 1 week. All right, Lynn, back to you.
Thank you, Kate. We're thrilled and grateful to have 3 speakers with us today, so we will dive right in. And our first speaker is Tessa Clemens. Dr. Tessa Clemens is a health scientist in the Division of Injury Prevention at the CDC's National Center for Injury Prevention and Control. Dr. Clemens, I will hand it over to you.
Thank you. Good afternoon, and thank you for the opportunity to speak to you today about racial and ethnic disparities in drowning death rates in the United States. In this talk, I'll first briefly go over key drowning facts and statistics, and then I'll specifically talk about racial and ethnic disparities in drowning rates by presenting the results of a recent CDC study. And finally, I'll briefly touch on CDC's role in trying to understand and address these disparities. So starting with key facts and statistics. Drowning is a leading cause of death for children in the United States. In 2020, more children ages 1 to 4 died from drowning than any other cause of death. For children ages 5 to 14, drowning is the second leading cause of unintentional injury death after motor vehicle crashes. Every year in the United States, there are an average of over 4,000 fatal drownings. On top of that, there are at least an estimated 8,000 non-fatal drownings each year. For every child who dies from drowning, another 8 receive emergency department care for non-fatal drowning. Non-fatal drowning can also result in more severe outcomes than other injuries. More than 40% of drownings treated in emergency departments require hospitalization or transfer for further care. And that's compared to about 8% for all injuries. The annual accrued drowning death rate for children under 18 years of age in the United States during 2016 to 2020 was 1.1 deaths per 100,000 children. This map shows annual child drowning death rates by state. The states with lighter shading have lower fatal drowning rates, and the states with darker shading have higher rates. Fatal drowning rates range from 0.5 per 100,000 to 2.3 per 100,000 children. And the states with the highest child drowning death rates were Louisiana, Mississippi, Florida, Arizona, and Alabama. The highest risk locations for drowning vary by age. Among infants under 1 year old, 2/3 of all drownings occur in bathtubs. For children 1 to 4, most drownings happen in home swimming pools. And more than half of fatal and non-fatal drownings among people 15 years and older occur in natural water like lakes, rivers, or the ocean. Some groups are at higher risk of drowning. I've already mentioned children. Males are another high-risk group. Nearly 80% of people who die from drowning are male. Some racial and ethnic groups have significantly higher rates of drowning than others, and I'll talk more about that later in this presentation. People with certain medical conditions, such as seizure disorders, autism, and heart conditions, are also at a higher risk of drowning. Certain factors make drowning more likely. This is not an exhaustive list, but some of the key risk factors for drowning in the United States include not being able to swim, missing or ineffective fences around water, lack of close supervision, not wearing life jackets during boating, and drinking alcohol during or prior to water-related activities. Some of the most effective drowning prevention strategies involve mitigating the risk factors that I just described. Drowning can be prevented by learning basic swimming and water safety skills, building and maintaining four-sided fencing that fully enclose the pool and separate it from a home with self-closing and self-latching gates, designating a responsible adult to supervise closely and constantly when children are in or near water, including bathtubs, wearing life jackets while boating, and life jackets can also be used by children and less experienced swimmers of all ages during non-boating activities in or near the water, and avoiding alcohol before or during water activities and while supervising children. Other drowning prevention strategies include learning CPR, knowing the risk of natural water and adhering to all signage and flags at aquatic locations, swimming with a buddy and choosing swimming sites that have lifeguards when possible, being aware of and implementing specific drowning prevention strategies for people with medical conditions, such as increased supervision around water, increased life jacket use, and taking showers rather than using a bathtub, and not hyperventilating or breath holding before swimming underwater, which can cause hypoxic blackout and drowning. Now I'll talk about racial and ethnic disparities in drowning death rates by presenting the results from a 2021 MMWR on that topic. For background, drowning death rates have decreased in recent decades. This chart from Franklin and colleagues' analysis of global burden of disease data shows that since 1990, drowning rates have declined by 57% worldwide and by 47% if we look at all high-income countries combined. The United States is included as a high-income country and not shown individually on this chart. But if we were to look at the U.S. specifically, drowning rates have decreased by 32% since 1990. A previous CDC study by Gilchrist and Parker in 2014 identified significant racial and ethnic disparities in drowning rates in the U.S. The 2014 study found that during 1999 to 2010, non-Hispanic American Indian or Alaska Native persons had rates twice as high as non-Hispanic white persons, and non-Hispanic Black or African American persons had rates 1.4 times as high as non-Hispanic white persons. The key question that we wanted to answer with the 2021 study was whether these racial and ethnic disparities had decreased along with decreasing drowning death rates. To answer this, we conducted an analysis using National Vital Statistics System death certificate data from 1999 to 2019, a 21-year period. We focused on people under 30 years of age because drowning is one of the 3 leading causes of unintentional injury deaths for each age group under 30. We calculated death rates and disparity rate ratios. Disparity rate ratios are calculated by dividing the rate in one group by the rate in another group to determine how much more likely the event is to occur in one group compared to another group. We used non-Hispanic white persons as the reference population, chosen because they represented the largest racial ethnic group during the study period. So a rate ratio greater than 1 indicates a higher drowning death rate in a specified group compared to non-Hispanic white persons. Conversely, rate ratios less than 1 indicate a lower drowning death rate in a specified group compared with non-Hispanic white persons. Race and ethnicity was categorized as non-Hispanic American Indian or Alaska Native, non-Hispanic Asian or Pacific Islander, non-Hispanic Black or African American, non-Hispanic White, and Hispanic or Latino. And we used join point regression to describe trends and changes in trends in annual drowning death rates and rate ratios. This chart shows the 5-year moving average in drowning death rates by racial and ethnic group during the study period. Drowning death rates decreased overall from 1.5 to 1.2 per 100,000 population during the study period. Annual rates significantly decreased for each racial and ethnic group except for non-Hispanic American Indian or Alaska Native persons and Hispanic persons, where there was no significant change in the rates over time. The highest annual drowning death rates occurred among non-Hispanic American Indian or Alaska Native persons, identified by the top purple line on this chart, and non-Hispanic Black persons, identified by the second from the top light blue line on this chart. This visualization shows the 5-year moving average in disparity rate ratios by racial and ethnic group during the study period. Using non-Hispanic white persons as the reference, rate ratios range from 1.8 to 2.2 for non-Hispanic American Indian or Alaska Native persons, and from 1.3 to 1.6 for Black persons, meaning that AIAN persons had rates 1.8 to 2.2 times higher than white persons, and the overall rate was 2 times higher, and Black persons had rates 1.3 to 1.6 times higher, or overall 1.5 times higher than white persons. There was no significant change in the non-Hispanic American Indian or Alaska Native to white rate ratio during the study period, so that disparity remained consistent the entire time. However, the non-Hispanic Black to white rate ratio initially decreased significantly from 1999 to 2005, but then increased significantly in recent years from 2005 to 2019. Drowning death rates and rate ratios varied by age and setting. For all settings combined, disparities in non-Hispanic American Indian or Alaska Native rates were present across all age groups. The highest rate ratios were among persons aged 25 to 29 years, with drowning rates 3.5 times higher in this age group, followed by children less than 1 year, with rates 2.5 times higher. Disparities in fatal drowning rates between non-Hispanic Black and white persons were present across all age groups except 1 to 4 years. The largest disparities were among children 10 to 14 years, where rates were 3.6 times higher for Black children. Racial and ethnic disparities were present in all settings and were most pronounced in swimming pool deaths. Compared with non-Hispanic white people, the highest rate ratios occurred among Black youth in swimming pools, where children aged 10 to 14 had rates 7.6 times higher than non-Hispanic white persons. Disparities in swimming pool drowning death rates were also present in most age groups for non-Hispanic Asian or Pacific Islander persons and Hispanic persons. Fatal drowning rates in natural water were highest among non-Hispanic American Indian or Alaska Native persons, with rate ratios across all age groups ranging from 2.1 to 4.0. The drowning death rate in natural water among Black persons was 1.6 times higher than among white persons, with the highest rate ratios again found among children aged 10 to 14 years. Our study found that racial and ethnic disparities in unintentional drowning death rates among people under 30 years of age were evident in 1999 and persisted through 2019, with significantly higher rates among non-Hispanic American Indian or Alaska Native persons and non-Hispanic Black persons compared with non-Hispanic white persons. Although drowning death rates decreased overall, racial and ethnic disparities persisted during the 21-year period, and the disparity between non-Hispanic Black and white persons increased in recent years. Multiple factors contribute to increased risk of drowning. However, the information available from death certificates, the data source for this study, limits our ability to explore these factors. More research is needed on the determinants that contribute to racial and ethnic disparities in drowning, including the barriers to implementing effective drowning prevention programs in communities at highest risk. Racial and ethnic disparities in drowning deaths differed by setting, and the most applicable drowning prevention strategies might also differ by setting. However, having basic swimming and water safety skills can be beneficial in all settings. Research suggests that Black persons report more limited swimming ability than members of other groups. Racial differences in fear of drowning have been identified as one potential factor contributing to limited swimming ability in some Black youth. Swimming skill and other factors contributing to increased drowning risk in AIN persons have not been thoroughly explored. Engagement of populations and communities at highest risk of drowning will be critical for developing effective programs and reducing disparities. So the key takeaways are that better identification of factors that contribute to disparities in drowning is necessary to inform drowning prevention interventions, and community-based interventions among disproportionately affected groups could help reduce disparities. With that in mind, I'll briefly describe CDC's role in drowning prevention and highlight a few of our projects that have the goal of better understanding and addressing disparities in drowning risk. In general, CDC uses data to identify and characterize drowning risk and inform drowning prevention strategies. We also provide technical assistance on drowning prevention to state and local partners and create and maintain partnerships to maximize impact. One of our key goals is to improve and promote the quality of drowning data and surveillance. And one of the ways we are doing this is by exploring methods to improve access to timely drowning data, such as through syndromic surveillance. We are also partnering with the National Network of Public Health Institutes and the National Center for Fatality Review and Prevention to improve data collection on circumstances of child drowning deaths and factors that may be associated with racial and ethnic disparities in drowning deaths. We are also working with partners including the American Red Cross and the YMCA to understand barriers to participation in basic swimming and water safety skills training for individuals from racial and ethnic groups at increased risk of drowning, as well as to pilot and evaluate basic swimming and water safety skills training programs for children and youth from communities at increased risk of drowning. In summary, drowning is preventable, yet it is a leading cause of death for children and young people in the U.S. There are racial and ethnic disparities in drowning death rates that have persisted over time and in some cases increased in recent years. Thank you. More information on drowning prevention can be found on our website, which is cdc.gov/drowning, and I can be reached at tclemens@cdc.gov.
Thank you, Dr. Clemens, for that presentation. I want to remind everybody that we will have time for questions at the end of the webinar. We'll save our questions after all three presenters have had a chance to present, and we'll take questions at that time, but please feel free to add your questions to the chat at any time. Next, I'd like to introduce Dr. Sean Anderson. He is an assistant professor in the Department of Health, Physical Education, and Exercise Science at Norfolk State University, located in Norfolk, Virginia. Dr. Sean Anderson, I will hand it over to you.
Hi, good afternoon, and thank you for having me. Where this started for me was exactly where we just left off with the statistics from the CDC, where the Black community, the African American community were seeing drowning at a higher rate. And my big question was why? How did we get here? Why are we drowning at this higher rate? I grew up swimming. I swam competitively, and I was really interested in this topic. And as we developed and looked into it, we kind of found out the why. And it led to the development of the African American drowning disparity cycle. So to start with this cycle, we kind of give you a walk through history, kind of combined with what's going on with Black America in the United States and aquatics, if you will. So if you start off looking back at Africa, there's documented research that from the 1400s to the 1600s that there is swimming ability. There's a lot of swimming going on, especially in the coastal lands in Africa. So we will see shortly where that kind of gets disrupted. It's not hard to guess, but again, there's example after example where there's Africans swimming off the coast of Africa in the ocean. We moved to slavery, 1400s to 1800s, and obviously this time in history disrupts a lot of things culturally, but it also definitely disrupts any kind of swimming or aquatic culture that was in Africa coming to the United States. I put two really good sites right there, from one from Lee Pitts, which talked about the fear of revolt, escaping slaves, and making sure that swimming ability was not present because some of the plantation areas were surrounded by water or had water barriers, if you will, and it was a way of escaping. And then I think throughout this, often in this research, it's like negative, negative, negative. It sounds really absolute sometimes, but there are some small examples even back then where there was some swimming, and most notably Frederick Douglass recalled some rec swimming going on. But obviously during slavery there wasn't a lot of rec anything going on, if you will. So that's 1400s to 1800s. If we move on to segregation, 1896 to 1964, of course, Plessy versus Ferguson, separate but not equal. The illustration, if you will, up there gives an example of two water fountains. Same thing happened with the building of pools. So the facilities, aquatic facilities and pools, if you will, if they were built at all in the black community, certainly were not on equal par with those built in many of the white communities across the United States. That's a huge piece, because during this time frame we see the building of a lot of pools. More during this time of segregation, again, you also have the YMCA greatly expanding and swimming programs actually beginning to flourish and being a big part of water safety, if you will, and competitive swimming. So all of these are growing, but largely the black community is left out of it. Another key point I think to mention is open water, so swimming at lakes or in the ocean. And you go to some of these black beaches, or what was the black beach during segregation, and to this day many of them are treacherous places to swim. Bad undercurrents, rough tide, but of course that was the portion, the area that was designated for black swimming. So with that, you have the development of some fear, obviously, because people are drowning in that area, and that's the only safe place for you to swim in terms of socially, because you're not allowed to swim elsewhere, but it's not in terms of just the overall dynamics of that open water setting. So with that, you develop this fear. The logical explanation or logical path, if you will, would to tell your children not to swim there. It's dangerous. It's not safe for you to swim. It's really not safe for you to swim anywhere at this point. That's a key pivot, if you will, that kind of adds on to this fear and jumps on top of the period of slavery in making this idea that the safe route is not learning how to swim or getting in the water and becoming water safe, or water safer, if you will, but rather to just stay away from it. Swimming ability in the 1900s, in 1900 to 1940 in the United States. So an important note, at this time in 1914, the American Red Cross reported drowning rate of 8.8, which is higher than it is today. And during that time period, there's a lot of building of pools. So again, reminder, 1914, 8.8. A key event in American history that a lot of people kind of do not, are not aware of is June 15th, 1904. You have the General Slocum. It's a day cruise that's going on the East River in New York, and it sank. It caught on fire and sank in the East River, and over 1,000 people drowned in that incident. It is the biggest loss of life in New York City up until 9/11. So you could see from the newspaper headline, this is a very, very big deal at the time, and helped spark a lot of water safety, as you'll see on this next slide. So shortly after that, you have the American Red Cross, obviously starting with Longfellow and really getting going on life-saving, learning how to swim. You're having national aquatic schools being built throughout the country. You are adding the requirements of learning how to swim in both K through 12 and at most universities. The YMCA's expand. Again, by 1914, there were roughly 450 YMCA's with swimming facilities, and that's growing and growing and growing. And again, as a reminder, the black community is largely left out of this growth. Boy Scouts is also growing with their water safety. And by the time you get to the end, 1947, this drowning rate has dropped from 8.8 to 4.8. Desegregation. So yes, didn't go that great in terms of aquatic facilities for Black Americans, although maybe they were desegregated. Still socially, there's a lot of de facto segregation going on where maybe by law you could go, but not really. So you have clashes. You have pools that rather than desegregate, they are filled in. And it is overall, again, continues this long bout of history where any aquatic or swimming culture in many Black communities is just non-existent. During this desegregation, again, another thing that we saw often was the building of private pools. So a public pool that they decided to keep open was desegregated. Okay, fine, and say they desegregate it and they build a private pool elsewhere in town and exclusive of African Americans during this time. I think this is a key slide, so I'm going to read it verbatim from Will. Some Black Americans learned to swim, but relatively few by contrast. Swimming became broadly popular among whites and developed into a self-perpetuating recreational and sports culture precisely because of because they generally had convenient access to appealing swimming pools. It goes on to say that the Black community was largely left out of this. So this is the time of segregation. With that, you have the reinforcement of popular culture. So some examples would be Million Dollar Mermaid, the surfing culture, Beach Boys. The list goes on and on. Gidget, where again, in these aquatic ideas, these aquatic settings in popular culture are void of Black swimmers, Black participants. Again, obviously they were few and far between, given the past history, but again, reinforced that stereotype that Black people cannot swim. This helps fuel myths. So you may have heard something about bones being heavier and Black people cannot float, or lung capacity. This history kind of leads to these ideas of why the drowning rate is higher in the Black community, or why some of the African Americans cannot swim. And these have largely been debunked physiologically numerous times. And again, in 1995, U.S. Army Research Institute found no such correlation. And again, Martin and Whitman, again, connecting that opportunity and that swimming culture being the real fuel behind the inability to swim in the Black community. Role models.
Audio recording for this meeting has begun.
I mentioned earlier that the, you know, in looking at this, you see a lot of examples of drownings and you know, sad parts of history of much of the Black community left out. I do think it's important to note that even through that, there are role models that did shine through, you know, Anthony Irvin, Maritza, Cullen Jones, Jim Ellis in Philly with his team, TBR, that are the subject of the movie Pride. There's pioneers throughout history that made it happen. So with all that, we developed the African American drowning disparity cycle. It starts first with historic barriers, which we pointed out here, slavery, Jim Crow, etc. This leads to a generation with fewer swimmers and fewer role models within the aquatic community. Step 3 of that is African American swimmers led to less African American aquatic professionals, aquatic athletes, which helps feed myths and stereotypes and false explanations of why African Americans don't swim. Those myths and stereotypes influence social norms. It feeds right into the ecological systems theory, where that feeds into what you do or what you don't do for an individual, and thus it becomes the norm that most African Americans did not swim. This ultimately led to the present day behaviors being recycled, becoming the future's past history, and thereby closing the loop on this cycle. So as those myths and stereotypes influence social norms, another generation is not learning how to swim, which becomes the new history, that ability rate stays the same, generations with fewer swimmers, less role models, and that becomes the cycle. So what do we do? And I think my colleague Dr. Lynch is going to touch largely on this, but I think it's important to remember that there's not a silver bullet to this thing. There's not just one thing that we can do and it wipe out these disparities. That's not how you balance an equation. We have multiple variables on one side that led to the current disparity. So we have to do multiple things, all of the above on the other side, to try to counterbalance this and start working toward making sure. It starts with awareness. So I think a lot of people jump quickly just to swim lessons. However, no one goes to swim lessons unless they're aware or their parents are aware that water safety is the issue. Unfortunately, I've met many parents who have lost their children who have done drug education and fire education, did not know that water safety was a thing. So we need to get that awareness campaign up and running and make folks aware that water safety is an important part of your general well-being. The other points in here are just breaking the overall traditions, those past cycles, so breaking those cycles, increasing awareness we talked about, personal hair and skin care after getting out of the water, dismissing the myths through role models, and I think it's important to note here, I do not just mean Olympic swimmers, I think aquatics directors, lifeguards, the list goes on and on to dismiss those myths and stereotypes and provide role models to the next generation.
Thank you so much, Dr. Anderson, for that information and your presentation. Just a reminder, please feel free to add your questions in the chat. Our final and third speaker this afternoon is Dr. Miriam Lynch, and she is the Executive Director of Diversity in Aquatics. So Dr. Lynch, I will hand it over to you.
Okay, and thank you all for this. And as Dr. Clemens and then Dr. Anderson and then now myself, think of this as a relay and all of the information building upon each other and really presenting towards the iceberg, the underneath part, towards why do we have the disparities that were talked about earlier in the presentation. Why is it that we have these gaps? Why is it that when we offer swim lessons in communities, what is the steps that are needed to make that connection and that bridge to communities towards decreasing those disparities? And so what is important for us is to consistently ask the question, consistently center ourselves in the why, what, and the how. As Dr. Anderson said, he eloquently just laid out for us what was the ripple effect of segregated policies and practices on a federal level that were part of power and influence that led to inequities on the state and community practices, and those impacts of those items, of those practices and policies that went down into the community, that caused the inequalities and disparities on the individual level. But we also need to talk about beyond those barriers that exist. We're talking about when we have the disparities, when we have the lack of facilities, when we have the lack of funding or the opportunity and the need for role models, we also need to talk about what is happening in communities when we do have access to everything. These are just a couple of the highlights that you see up on your screen in front of you of barriers that are beyond the three that you see up there, that have an impact on, that combine the economic, the political, and the social components towards the barriers towards getting into swimming and aquatics. So I ask this question. As we go through this work, all of us have to ask, are we an ally? Are we an accomplice? Or are we a co-conspirator? What are we going to do, the work towards making the change that we want to see, towards decreasing the disparities? Because a lot of times we go into a community and we say, hey, we have free swim lessons. Are you about just supporting the equal justice in theory? Or are you actively working to dismantle the systems of oppression that have created the disparities that you see? Are we empowering communities with information? Are we starting with the awareness, as Dr. Anderson said? And then the last one, are you a co-conspirator? Meaning that, are you working alongside communities? Are you working with church groups? Are you working with local youth groups? Are you listening to the needs of the community to find out that where does the fear lie? What is the cadence? What is the culture towards the water before really going in and making the full implementation of programs? Because right now where we are and what Tessa has indicated in the study, we're at an increase right now for the inequalities. And what we've seen is that we've had an increase in drowning rates, where a few years ago it was 10, now it's 11 per day. So it really makes us have to examine when we're having programs, or when we say we have equality in our programs, what does that look like? When we say that when we have equity, what does that really look like in our communities? We really need to take a reflective look and examine the system in which how are we providing and meeting the challenge of the statistics that we see today. Because where we really need to be is in the justice part. And in the justice part is fixing the system. Fixing how are we talking about disparities? How are we talking about communities? How are we engaging leaders from the community part of the conversation? Are we involving schools? Are we involving other components to help us towards fixing the system that Dr. Anderson said and highlighted, that talked about that it is broken? Because the system was created in aquatics that was to eliminate and to move dollars out of Black and brown communities, to put cement over pools, and was talked about in policy and more. So the work is both you as an individual to take this reflection, and as organizations to take this reflection in the work that we do. It's about educating ourselves and each other about the topics, because it's crucial for us to be educated in order to find a path forward, to be educated in what has caused in communities this ripple effect of where we have pools in certain communities that have the slides and diving wells and all the activities, to other communities that we only have splash parks. And many, if you look at it, they are the communities that are lacking in swimming facilities or safe areas have been historically made that way. So the work is both for us individually and by the organization to make that change. So as it said, I'm the executive director for Diversity in Aquatics, and for us, centering on all that we do is justice. We work to educate, support, and promote water safety and healthy aquatic activities and opportunities in our communities. And the reason why we center justice for it is to fix the system, is to eliminate the barriers, is to create sustainable programming and more. Because what is needed in this space is the work between both organizers and communities in order to make swimming accessible for all. Okay. So we constantly have to ask these questions. And I love this by Dr. D.L. Stewart, that asks the questions when we're centering and looking at where we are, and we're doing the work of diversity, equity, inclusion, and justice. We're asking who is in the room. We're asking how are they being affected. We're asking what is happening and what is not being said that should be said. Are we grounding ourselves in the research and understanding the historical makeup that has created what we see today? And are we understanding and centering the why? And continuing to put the community at the center of all of the work that we do. For us, diversity in aquatics, we take a multi-sectoral approach. And I really credit Dr. Angela Beal-Tafik, being a lead researcher in this space, is the concept of multi-sectoral is that it's not just for the aquatics community to be a part of this, but reaching outside the aquatics community in order to making those connections. Because together, we're going to have to work, and what we do is work with communities towards eliminating the barriers, whether it is suits, whether it is policies, whether it is funding, or whether it is other things in training. That is one of the first things we need to do, is to eliminate the barriers. We also need to increase awareness. Awareness, as Dr. Anderson said, is that it's such an important step, is that you don't know unless you are educated. Just like in schools that you look across, you learned in your health class about car safety or poison control and more. We need to do the same thing with swimming and water safety. And then the last thing is creating sustainable programs and partnerships with other organizations. And for us, we've been so fortunate to be able to work with so many different organizations in this realm towards addressing those three topics. So one of the things I want to have for you as a takeaway is first to educate yourself. When I talked about you and your organization, is to educate. And there's a number of resources here that I'm providing on ways that you can have takeaways on educating towards understanding where we are historically and what has made the impact towards addressing fear or the barriers in aquatics or towards water safety. One of the big things that we do is International Water Safety Day, in which we've reached over 1 million people with the water safety message towards bringing awareness as that first step. There's research that is in DEI research that has been done, and then again, being led by Dr. Angela Beal-Tafik. In this area, we have a special journal that is talking about all of the different aspects from the community to the national level. And then, of course, different projects that we have between webinars, our project up in Philadelphia, the pool project, which you can see, and then the film, Wade in the Water, which really gives you a visual representation of what Dr. Anderson was saying earlier. And then also promote. And what's important about promote is that we need to support communities, such as this one, I Deserve to Swim. This was up in Philadelphia. And then other policies and communities do need to be worked with. There's a difference in being able to work in communities versus working with communities. Because when you work with communities, you can help celebrate and empower them. But it's also important, as you promote, is that you also help to protect communities. Protect those who are in that space and being aware and addressing things, and being able to protect their voices and bringing those who have the knowledge to the table. And then the last thing is to support. And when we're talking about support in our communities, we're talking about assembling, getting together everyone from the community to have a voice, having a seat at the table, identifying the distinct things that are needed in order to decreasing the disparities in that community. Is it that you need life jackets? Is it that you need funding, transportation, and more? Working to collaborate with different diverse groups in your communities, such as your Jack and Jill organization or your Boys and Girls Club, and then doing the work itself on the ground. That is the important part. So in summary, I just want to say thank you, but altogether, we're all in this space, whether we are in aquatics or a researcher, or we are in water polo, swimming, or diving. We're all in this together because when we first start with awareness, we can get more people into learning to swim and being water safe. But then not only that, having the communication that's saying that once you learn to swim, you have a myriad of different possibilities. So thank you so much for today. If you have any questions, please feel free to reach out at the following.
Thank you so much, Dr. Lynch, and thank you everyone for those great presentations. There's so much information and so many things to explore and to explore further. So we have lots of questions from our audience members that I'd love to have a conversation about now. The first one I want to start where you left off. You mentioned this, Dr. Lynch. As we all pop on camera here. Nice to see your faces. So there's a couple questions or comments about the aging infrastructure of community pools, and as you mentioned, replacing community pools with splash pads and things like that. How does that contribute to increased drowning? You mentioned, the reduced opportunities for swimming lessons. What are some action steps we can take in our communities, to address this or to potentially create more opportunities for swimming lessons at in community spaces?
Yes, it starts on the local level. Just like right now, what's happening with the going out and voting and being a part of the community conversations. We need more people that are a part of the aquatics profession and have the aquatics knowledge to be a part of the discussions in the budgeting meetings at your local city level. So that's where you can start advocating for more funding to go into the areas where it's needed and to reallocate funding or fight or I would even say fight for funding. I'll give my own example. In the city of Alexandria, being a part, we just built a new waterfront way. And a part of the discussions when they were first building it was the topic of safety. What are we going to do as part of a barrier towards safety? Because there was, in the plans originally, there were no fences. And so what we advocated for was to have those ring buoys to make sure that that was in place as a safety mechanism to being a part of one of the barriers towards drowning prevention. And I think it's important for people to realize the power that they have on that local level to make that great difference. And I give the example on one of my slides is Maura Reed, who did that. They put cement on the in one of the pools in her neighborhood. They had a pool from when she was growing up. Later on, they cemented it over because they said of funding. And later on, she got the community to rally behind and build a new pool. It's called, as a matter of fact, it's named after her. It's called the Maura Reed Waterworks. So when we're talking about building splash parks are great, but they aren't where we can have lessons and do the next step in drowning prevention. But you've got to have your voice heard in order to make sure that you tell the city government about the need for that in your community.
Thank you so much. If either of the other two presenters would like to comment on that question, please feel free to jump in. Similarly to another question about policy and field trips, is someone is asking if you know if any state's department, Child Care Administration have included water safety training or the use of life jackets to their code when taking kids to field trips or pools. Apparently in Texas there is no requirement for that, so they're asking about what you know in other states across the country. Anyone can jump in and answer if you're aware of any state's policies or regulations.
So I'm not aware of all of them to sort of speak comprehensively offhand, but it is something that we're interested in looking into, collating water safety policies across the states and sort of understanding different effectiveness or what improves implementation. So not something I can answer today, but hopefully in the future.
Great, thank you. One of our participants says there is a team working on creating a national water safety action plan for the United States, and the plan is in the final stages of being drafted and about to go into public comment. Has this information from these studies and recommendations been shared with anyone on this committee? Are any of you aware? I'm guessing you're participating or your organizations are participating in this National Water Safety Action Plan.
Hi, this is Sean Anderson. I'm very much a part of that effort right now. It is in progress, but it's coming together. A lot of water safety experts from across the country are weighing in, and it's going through our process to hopefully eventually make it public. And I think that's, if you refer back to the last question, that's the kind of things that we're looking at of what makes for good policy on a state level, on the local level, on the national level to help curb drowning even more. So yes, we're working on it.
Thank you. Thanks for jumping in. That's good to hear. There's a question about near drowning, and if there's data, well, first asking what is near drowning, and if there's data on the incidence of near drowning and how that relates to drowning in general and statistics of drowning.
Yeah, I'll jump in on this one. So I would call it non-fatal drowning. And so these are instances where the drowning process started, meaning that a person was submerged in liquid and experienced respiratory impairment, but that process stopped before death. So if a person experiences respiratory impairment from submersion or immersion in liquid and dies, that's a fatal drowning. But if they experience that respiratory impairment and are rescued and don't die, then that's a non-fatal drowning. And a non-fatal drowning can have a range of different outcomes, from no morbidity, where the person is completely fine after they're rescued, to very severe morbidity that leads to long-term disability or other poor outcomes. So I talked a little bit at the beginning of my presentation about non-fatal drowning. So there's estimated at least 8,000 emergency department visits for non-fatal drowning each year. And particularly for children, there's a high burden of non-fatal drowning. So for every one fatal drowning, there's about 8 non-fatal drownings requiring an emergency department visit in the U.S.
Thank you. That is a new term and new information to me for sure. So thank you for sharing that with us. How can we encourage more families to enroll their children in swimming programs, and what are some of the main organizations or ways that families and communities can access free or reduced priced swimming lessons?
I'll say a little bit. I think it's going back to what Dr. Anderson said, it starts with awareness. One of the big things that we do is International Water Safety Day, because it falls within the school year. And just like your recycling program, when you learn that in school, or the technology you learn and you take it home, it's a chance for those who do not have a curriculum to be aware first, and then be able to have that as an introduction towards getting into swim programs. It's also a chance for swim programs to have an introduction into different areas that are not aware of what the possibilities are for what their program provides. So, for instance, I was a coach at Nation's Capital here in Washington, D.C., and it was an opportunity for us to say, hey, we have these swim lessons. Here are the different opportunities to get involved with those swim lessons on International Water Safety Day. We have a course on the July 25th. It's also the UN World Drowning Prevention Day, which is also another opportunity for organizations who come from an aquatics lens to go into areas that, or be a partner with community groups as an introduction to all the different possibilities and opportunities that they have as their program.
Thank you so much. I think we maybe have time for one more question. And this relates to parent-caregiver information again. And where can folks find information that's specific to American Indian, Alaskan Native regarding drowning and water safety? So I think the question is asking specifically for families from American Indian and Alaskan Native communities. Is there water safety information specific to that community, and where can they find it?
So just off the top of my head, I have seen some really interesting life jacket campaigns coming from AIN communities, which I've seen on YouTube and through other sort of social media sharing. But the asker of that question, if they want to send me an email, I can follow up with more resources that I'm aware of.
Great. Thank you so much. I think that is all the time that we have for questions. So thank you again for all of you participating, for answering the questions, and for your really great presentations. We're going to see a slide in just a minute where you will be able to register for the next webinar coming up in the series, which is about advancing health equity through a multi-agency collaborative approach. So that's the next webinar through the Children's Safety Network, and we welcome you to sign up and register for that at the link below. And again, just want to thank everyone so much for your participation, particularly our speakers and presenters, and thanks everyone for making time today for this great information and really important webinar.